What's the first letter of your name? What's that? A. Okay, what's the next letter?
Oh, where does that one go?
Where does it go? Where does the L go?
There it goes.
What's the next letter?
E.
E. Where does it go?
Where does that one go? That's right.
Good boy.
Should we scoot them over so you have a little more space? That's right.
What's that say?
You just spelled your name, buddy. And now we're going to do it all over again.
It's Amanda and welcome to my channel Eat Pray Crunch. This is my pregnancy update for week 37. So this week is lots of little things, nothing big. I went to the midwife last week and this week. I'm going every week now, and they confirmed both times that baby girl is still head down. Woohoo! Really excited about that. I'd be pretty surprised though if she flipped back at this point, just because she's getting so big and there's not really much space for her to do so. Anyway, so we're hoping that she stays that way. The appointment that I had with the midwife last week, she had to actually go in and do like a vaginal check to make sure that it was her head that she was feeling head down, because I think baby girl was sunny side up, so it was hard to tell for sure her orientation, because it was hard to feel like her back and her butt and stuff. But when she did an internal exam, she was like, yep, that's a head down in your pelvis. So I was like, thank God. And she also, this time and last time, also did a cervical check for me to see if I was dilating at all, and I just requested that. She wouldn't necessarily have done it. And I didn't realize that the cervix can actually dilate at different rates at like the top versus the bottom. Who knew? But she said that the bottom of my cervix is dilated 2 centimeters already, and the top is still tight and closed. So, and that I guess I'm 50% effaced. So all of those really crampy Braxton-Hicks contractions that I've been having, and I've been having a lot of them, let me tell you, I guess they are productive. So I know that it's not necessarily an indicator that labor is imminent or anything like that. You can be dilating for like several weeks before you give birth. So, but it was just interesting information to know that, you know, my cervix is just starting to do its thing. So, you know, everybody keeps telling me, you know, my first labor was 35 hours. It was long. It was a difficult labor. Everybody's telling me, the midwives, everyone's saying, second labor almost guaranteed to be faster, like significantly faster. My midwife, I actually got to see the main midwife. She had been on sabbatical for a couple months and she was back now, so it was really nice to have an appointment with her this week. But she said she's delivered 1,500 babies, and in her experience she has seen that with second labors the average is like 7 hours or so, regardless of how long your first one was. I mean, if you had like a ridiculously short labor the first time, you're likely to have a short labor again, but if you had a really long labor the first time, that doesn't necessarily mean that you're going to have a really long labor the second time. And she said that that's like a mistake that she's seen second-time moms make before, especially the ones that had really long labors like me, because they often go into it thinking, oh, this is going to be a long haul again, and they stay home, and even though they're progressing faster than they think they are. And so she said, really pay attention to your contractions, and like once they get to be 4 minutes apart, and even if they're not even that close together, but if they're to the point where they bring you to your knees, then they want me to call, basically, because she has seen a lot of second-time moms, you know, progress a lot faster than they thought they would and not call in time. I've heard from friends and whatnot that with their subsequent labors, they have this prodromal or like early labor that can last for weeks beforehand, where they're like dilated 3 or 4 centimeters within those weeks, and then by the time active labor really starts, it goes really fast. I'm just wondering, since I'm starting to dilate a little bit now, if that's going to be the case. Who knows? We'll see. I'm just willing to go with the flow. My only hope is that it's not scary fast. I really doubt it will be scary fast. But, you know, like a 7-10 hour labor sounds so manageable to me. After having gone through 35 hours, that just sounds like, I can do that, you know? Like even if it was 24 hours, I'm like, I can even handle that. That's better than 35. But, you know, I'm just open to whatever happens, happens. I'm just hoping that it doesn't happen so fast that it is scary that, you know, that I barely get there in time, or, you know, that my friend Katie and that like my mom can't get there in time, or if it happens while Bill is at work and it's like rush hour or something like that, that he wouldn't be able to get here in time. Unlikely. But I am hoping that, you know, it's long enough that everybody can get there, but short enough that it's like a lot more manageable than my first labor. Ooh, speaking of Braxton-Hicks, I am having one right now. Ooh. Sometimes they are getting pretty intense now. Like, they're not like so intense that I can't keep talking. Clearly I'm still talking, but sometimes I do have to just like sit back and kind of breathe through them a little bit. They definitely are getting, you know, gradually, you know, more intense as time goes on, but there's no regular pattern to them, and they're not so intense that I, you know, can't carry on with my life. So I know it's not real labor yet, but I am getting a lot of those Braxton-Hicks during the day, every day now. So I know my body is gearing up. So since baby girl has flipped head down, I think I may have mentioned this last week, but I have been feeling so much more movement from her. Like something about her being in that head down position like really freed her up. And I'm not sure if it was just because she had difficulty moving when her legs were in my pelvis, you know, when she was breech, and like now she has like all this freedom up top. I don't know what it is, but I am feeling a lot more movement now. I definitely am getting like really big punches, like, or like sometimes she even stretch and I can like see my whole belly kind of like do this weird stretching thing. Or when she kicks, it's like I'll see it. There's a little foot kicking my belly. Or, you know, the like sweeping movements where I can see this like foot or knee or whatever it is just like really poking out and moving. It's really kind of cool. So that's been really assuring, just feeling all of that movement. You know, I mentioned that for a couple weeks now I've been going to, or I guess almost a month now, I've been going to a new chiropractor that I really like. And I told her, you know, that I basically did like a really gentle external version on myself, and, you know, did it really slowly, described what I, you know, described last week. And I was surprised just how supportive she was. Like, she was like, oh, that's just like way better than you going into an OB and they just like whip it out in 10-15 minutes and you end up with bruises and pain and everything. And I was like, well, that's an interesting perspective. Like, I was expecting, you know, the full, you know, you shouldn't have done that. But she was actually really supportive, just like really, you know, trusting that I knew my body and knew what I was, you know, what I was doing. And so I was like, well, that's nice. And then it really got me thinking about it. Like, I feel like, you know, maybe this is kind of typical of, you know, standard conventional medicine, where they, especially in the OB world, where they really do try to, you know, get as many patients in and out of their office as quickly as they can. It's not really about forming like a real relationship with you, but they just, you know, want to get those patients pumped in and out, you know. And because of that, you know, they, of course, they wouldn't take an hour to do an external version on you. Like, they are just trying to get it done and move on to the next patient, you know. And I'm sure it's not like that with every OB. Like, I'm not making blanket statements here. Like, I know there are some really good, thorough, kind OBs out there. But then again, there are some that are not too. And it just makes me wonder, like, I watched a lot of like YouTube videos about different OBs doing external versions, and you could really tell that there were some that were much more skilled at it than others. And I've read stories from people too that said that they had really differing experiences with their external versions depending on which OB did it for them and how skilled they were at it. You just hear so many stories of women who have an external version done, and they end up with bruises. Like they have to give you drugs to relax your uterus because, you know, they're not going to pause when you have a Braxton-Hicks contraction. They're just going to keep on going, you know. And because they're doing it so fast, that could be, you know, possibly more traumatic to baby or the placenta or whatever. It just makes me wonder if like that's why it's so painful for so many women to have an external version, is just because they're doing it so fast. And if that's causing some of the, you know, even though complications don't happen that often during external versions, when they do, it just makes me wonder if it's because, you know, it's kind of rough. Like they're being very rough with your belly, with your baby, and doing it very quickly. And it just makes me wonder if that actually causes some of those complications that do arise now and then. It just made me wonder, like, if they did, you know, take the time to do it more slowly and gently, and like, you know, communicating with the mother about what she's feeling while they're doing it. You know, I wonder if maybe it wouldn't be so painful for so many women, or if there would be fewer complications associated with doing external versions. Who knows? I was just kind of hypothesizing about that, and it just kind of made me feel better that me doing it myself, like, that I was taking the time to do it so slowly and listening to my body and like stopping when I had a contraction and just really listening to my body and taking my time. Like, it made me feel a lot better about the fact that I was doing that, and that it was probably quite safe doing it that way, actually. So anyway, just some reflections about that. So last week and this week I actually had 2 acupuncture appointments. My acupuncturist likes to see patients soon before they give birth to basically help your body prepare for labor. And I had actually initially made the appointments because it could also help with turning a breech baby, but by the time I got to him, she was already turned. I was supposed to go in for 4 visits, but it is a long drive for me to get down there from our new home where we live now. It's like close to an hour drive, and often get caught in nasty traffic. And so I was like, is it okay if we just do 2 appointments and call it good? And he's like, yeah, that's great. So I had my 2 acupuncture appointments, one last week, one today actually. I've just been so tired lately, and after my appointment today, I just, you know, I actually fell into a really deep sleep during my session, even though it was just, you know, I was laying there for maybe 20-30 minutes. I just felt so rejuvenated afterwards, and all of a sudden I was like, all right, I have energy to nest, finally. And so, yeah, so nesting. Speaking of which, moving right along, I got the nesting bug bad again today. I got the little co-sleeper for baby girl set up in our room, and I got, you know, all the receiving blankets out. Our bags are mostly packed now, and I've been, you know, going through all of the gifts that I got from my shower and writing thank you notes, and, you know, washing all of the new clothes, organizing all of the clothes by size and everything. I just feel like, you know, we're really starting to get there now. Like, we're gonna make it. Like, if I go into labor tonight, like, I think we will be prepared enough. But that said, because up until today, like, my energy has been terrible. Like, you know, just like I said last week, I have been so lazy, so exhausted. It's like I hardly have it in me to do just the bare minimum stuff to get by each day. So because of that, I have been really prioritizing which nesting things need to happen, you know, more than others. And so, you know, really was focusing this last week on getting the things done that have to be done before she arrives. Like the things that have to be done for her birth and soon after we get home. And so, you know, I basically pulled out, you know, Alex's old car seat, got it all cleaned off, and put the new cover on it. I got one of those, like, you know, snuggly little zip up covers for it, and a car seat canopy, put all that together, installed it in the car, so that's ready to go. And got most of our packing done. There are still a few items that I need to throw in there. But my, Bill's bag is packed. Mine is pretty much packed. I have all of the newborn cloth diapers ready now, and the disposables that we'll start with. And I just feel like, those basic things are ready to go. Like, we have the newborn clothes, the receiving blankets, like, basic things are ready to go now. And from here on out, I'll just be, prioritizing, because it's like, I have to balance my limited energy with, what I can realistically get done, And so I'm trying to give myself grace about that. The whole nursery doesn't have to be completely done. Like, it's okay if the house isn't immaculate and there's clutter, I will work on those things, but, I'm going to start with the highest priority and work my way down the list, if you know what I mean. So that's how I've been nesting this time. I really feel like it's really been different than nesting the first time. When I was pregnant with Alex, I feel like I got these huge bursts of energy and I would just like get all this stuff done. And I haven't had that so much this time, and I think it's because I have a toddler. And because, I'm the kind of person where if I start a project, I just like need to get in the zone, you know what I mean? And have an uninterrupted time where I can just like focus for several hours and get things done. And that just doesn't happen when you have a toddler anymore. So it's like I have to just do little bits of things here and there when I can, and it's just not as productive as it was the first time around. So, but I'm just trying to give myself grace. Like, this is just how it is this time, and that's okay. We're gonna get there. If we have a baby tomorrow, like, we'll be fine. But speaking of, being a pregnant mother of a toddler, Alex has really had disturbed sleep the last couple weeks. Generally, he's like a rock star sleeper. Like, he started sleeping through the night. I mean, what they count sleeping through the night at like 5 hours, whatever, when he was like, maybe 4 months old, and was doing like 10 to 12 hour stretches. But by the time he was like 8 or 9 months old, there are obviously times where there are exceptions to that. The biggest one being when he was teething. Every time he was cutting a tooth, there would be a couple of nights of disturbed sleep, but then he would go back to normal. Or when he was sick, or, whatever. But for the most part, like, he's a really good, solid sleeper. But this last week or two, he's just like really been having a hard time. And granted, we moved him into his big boy room, but the first few days he was in there, like, he had no problem. He did his normal like 11-12 hour stretch of sleep. A few days after that, he started waking, like, it started out more slowly, like where he was waking like, 1 or 2 times at night, and one of us would have to get up and rock him, give him some water, put him back down to sleep. But every few days, it seemed like it would be more frequent and worse, to the point like where in the last couple of days, he's been waking like 3, 4, occasionally 5 times at night. And so we're trying to figure out what the heck, like, what happened? Like, you've always been our rock star sleeper. Like, what is going on right now? I'm thinking what this really is about is that Alex is probably sensing that there is this big, huge, imminent change that's about to happen. We talk about having baby sister. He's going to be big brother. We talk about that a lot, and I think that he, we read the books about it, and I think that, I don't know to what degree he understands it, but I really think that he has this, like, instinct that something is about to change, and it's causing all these, like, emotional needs for him. And I think that that's actually pretty typical, of toddlers when they're about to have a new sibling. They're just kind of unsure of the situation. All these changes are happening. Whew, having another Braxton-Hicks here. He's just been a little more needy, especially at night, and it's like, all he wants when he wakes up and he starts crying and crying, and we go in, and all he wants is just to snuggle. That's what we've been doing. And at one point Bill was like, maybe we need to fervorize him a little bit, let him cry it out a little. I was like, I'm generally okay with doing that, to some extent, but I think that the context that it is right now and the reason he's doing it, I think, is an emotional reason, because there's this big transition coming. And I was like, I don't know if right now is the appropriate time to do fervorizing on him, especially since he's normally such a good sleeper. Last night, Bill and I were both just exhausted and getting kind of frustrated that, we kept getting woken from like a deep sleep to a crying toddler. You know, I just had this moment after I came in from snuggling with him at, 3 o'clock in the morning or whatever it was, and I was like, you know what, this probably is going to be a short-lived thing. Like, we just have to get this through this transition, and he just really emotionally needs our reassurance right now. So I'm just trying to be at peace with that and, trying to provide that for him. And it was nice when I got back in bed, like Bill reached over and he just like held my hand. And I was like, oh, thank you for doing that. Like, it just kind of felt, with just him doing that just kind of made me feel like, you know what, we're in this parenting thing together, we're a team. It made me feel like, even though we're exhausted and, this is exacerbating it, like, this is just part of being a parent and we're in it together and we're gonna get through it. But yeah, speaking of Bill, I think he's starting to get really excited. He's been like unusually affectionate with me. Like, he can be affectionate, but that's not like his like primary love language. But like lately he's just been really affectionate, and like he's coming up and like rubbing my belly and talking to baby girl and just giving me lots of hugs and saying, oh, I'm getting so excited to meet you, baby girl, and it's really sweet. So I think it's starting to hit him too, just how close we are and how our lives are going to change really soon. And even though we're so stressed and exhausted a lot of the time, and even just like bickering at each other a lot of the time, and it's like, oh, just him being that way is just like, oh, that makes me fall in love with you all over again. So just random symptoms that I was going to mention. I know I mentioned a couple months ago that I have had this persistent cough. Especially when I lay down at night. It's like I have a coughing fit when I first lay down, and then it goes away and I'm able to fall asleep. More recently, it's kind of gotten worse. Like even during the day, if I breathe all the way in, it just like sends me into a bit of a coughing fit. And so I actually decided to go to our primary care, which is our nurse practitioner, and she actually decided to put me on a pregnancy-safe antibiotic to rule out any infection in my lungs. So I actually just completed that yesterday, and it seemed to help a little, but the problem is still there. So that means that, she said that it is likely pre-asthma, which is a little crazy since I've never had asthma problems in my life. I've never had lung problems in my life. Like, maybe had bronchitis once or twice when I was a little kid, but how weird is that? I hope it's just this weird pregnancy thing. She actually prescribed an inhaler for me, so tomorrow I'm going to start with that and see if it helps the problem at all, because it has kind of progressively been really gradually getting worse over the last couple months, so we'll see if that helps. So I've also been getting heartburn this week. Like, I really feel like it hasn't been that bad most of my pregnancy. Then this last week, bam, heartburn hit hard. So I've been dealing with that. It's usually after I eat something, as long as I stay upright, I'm okay. Like, I can still feel it, but if I lie down, it's like, whoa, that's no good. So I have to stay upright after I eat for a while, and that helps, and drinking milk helps. Anyway, so I've been dealing with that. It's not terrible, but it's there. You probably could see just in my belly shots the last week or two that my belly button has popped out. Like, not completely, but like partially. Turkey timer's up. Baby's done. As for weight gain, I am now up 52 pounds. It really has gone up fast the last 2 or 3 weeks, which is, I know, normal for the 3rd trimester. So yeah, I'm predicting that it's going to be the exact amount of weight gain that I had in my last pregnancy, which was 55 pounds. So I'm at 52 pounds at almost 38 weeks now, so I'm figuring it's probably going to be just like last time. Last thing I was going to mention was that starting at the end of this week, or at the beginning of 38 weeks, I am basically going to quarantine us. After I had my son, we got really sick. And I know it was because we were exposed to a really sick child a week before I went into labor. We had gone to this church small group, and there was this little kid there that was blowing snot rockets all over the place and had a fever when we were there. And honestly, like, I still get kind of upset thinking about it now that that they didn't even give us any warning before we came over. We just came over and there was a feverish snotty child that was, I mean, like seriously blowing snot all over the house. It was like getting on things. It was gross. And me and Bill and newborn Alex at the time, we got so sick. We all had fevers. We were so congested, and then it moved into this horrible cough. And, you know, I was, you know, recovering from a 35-hour natural vaginal delivery, and you can just imagine what having a nasty cough, like the day after you give birth, like you can just imagine what that does for a recovering postpartum body. Not comfortable. I really kind of feel like I was traumatized by that. Like, I almost feel like I was more traumatized by that than like my birth. It was just such a difficult recovery because of that. We were so sick, and it was scary with having a little newborn that was so sick. You know, we had to suction his little newborn nose, and he hated it, and he was having a hard time breathing, and it's kind of scary, you know. And so this time I am being complete germaphobe. I am quarantining us to our house. Like, me and Alex, we are going to mostly stay home unless we have to go somewhere. I will go to my midwife appointments by myself. Alex will stay with Grandma while I do my last couple appointments. And any shopping we need to do, I'm going to have Bill do it. I don't want to have Alex on a shopping cart, like licking it and putting his hands on everything and licking his hands. I am just like being so paranoid about it right now, and so I'm like officially doing a quarantine starting at 38 weeks. I just don't want to be exposed to anything nasty right before giving birth, since I had such a bad experience with that before. And there are some nasty things going around right now too. Like, I keep seeing friends posting about stomach flus that are going around, like strep throat, like there's still nasty junk going around. So I'm like, we're steering clear. We are just going to stay in our house for a couple weeks. I mean, I'll take Alex out for walks and stuff, but other than that, we are going to have a very cabin fever lifestyle. Hopefully it won't be too bad. But that's my plan for the next couple weeks. Granted, there's plenty for me to do here at home with all the nesting and cleaning and everything that I want to get done, so it should still keep us nice and busy. So that's all for this week, you guys. Let me show you my big old 37-week belly. Alright, here is 37-week belly. I am feeling so stretched now, it's unbelievable. It's like getting to the point now where I feel like, is it even possible for me to stretch any further? And then I do, then I stretched a little bit further and a little bit further. And there it is. Alright, you guys, that's it for this week. Thank you so much for watching. I will be doing a couple short videos coming up. I'm going to do a video about how to do a little preparation for postpartum, and I'll probably be doing a video of some of the things I got for my baby shower. Since I'm getting so close now, who knows when I'm going to go into labor. With all of these Braxton-Hicks and nesting, like, who knows? I kind of am having a feeling it could be sooner rather than later, but we shall see what happens. So stay tuned to get upcoming updates about all that. So anyway, hope you guys have a wonderful week, and I will see you hopefully next week for my 38-week update. Hope you guys have a great week. Take care. Bye-bye.